Hi, good morning, Tim.
Morning.
My name's Dr. Henry, and we're today talking about the treatment for your prostate cancer.
Okay.
And so just to recap through what's happened is that we've found that after you've had your previous radiotherapy treatment to your prostate, your PSA blood test has gone higher. So that's gone up to 3.
Okay.
And we've done a scan, a PET CT scan, and that shows that there is a lymph gland in your pelvis that looks abnormal, suggesting that the prostate cancer has come back in the pelvic lymph gland.
Okay. Just the one.
Just the one lymph gland.
Okay. Nowhere else.
Nowhere else. So the prostate itself looks clear.
Oh, good.
And there's no evidence of any cancer elsewhere in the body. We just have a single lymph gland involved.
So you're just chasing one bit of it.
Yes, so that's very reassuring. And what we want to do is to use some radiotherapy treatment again to try and get rid of the cancer in that lymph gland.
Oh, okay. Yeah. So I don't have to go on chemo or anything like that.
No, so you don't need to have any chemotherapy treatment. It would be radiotherapy treatment. Okay. The treatment that we have, radiotherapy, there are 2 different ways of delivering that treatment. One is by just targeting the radiation at the lymph gland itself.
Yeah.
And that's something called stereotactic radiotherapy, or SBRT. So the treatment's very effective, but we're looking in a study to see what the best way of giving the radiation is. The best way to use that SABR, that SBRT, or is it to give a wider pelvic radiotherapy treatment? Because sometimes what we see is that the cancer can come back in the lymph glands next door to where you had the treatment before.
How many lymph nodes are there then?
So we have lymph glands all over our body, and you have multiple lymph glands in the pelvis.
Okay, right.
So we can do it. We just see one abnormal lymph gland on the scan, but sometimes there can be small cells elsewhere in lymph glands in the pelvis that we don't pick up on the scan. So because of that uncertainty, we're doing a clinical trial, a study, to see what's the best way of giving the radiotherapy.
Right, okay.
And so in that study, half the people have the stereotactic radiotherapy, the SBRT, to the lymph gland. That's the
focus.
The very targeted focus treatment. And the other half of people have a bigger volume of pelvic lymph glands treated to try and pick up any of the microscopic cells that might be elsewhere.
Bigger volume, you mean?
A bigger volume.
A bigger part of your pelvis is?
A bigger part of your pelvis, yes.
Okay. Just thinking about that, how do you know which? I know you say that you're trying to find which is the best treatment. So in my mind, it would be which is the worst treatment. Are they equal?
Yeah. So at the minute, we don't know which is the best treatment. Both treatments actually are very effective, and one may be slightly better than the other.
Okay.
So the advantage of the focused SBRT is that there's very little risk of getting side effects from treatment because it's very targeted. When we do the more extensive pelvic radiotherapy, it may be a higher risk of getting side effects from treatment, and that could be trouble with your bowels, trouble with your waterworks. And because we don't know which is best, we want to do a study, a clinical trial, where we look at large groups of people going through treatment, we follow them up regularly, and then we can say which is the best treatment for people.
Right, okay. So will the wide one, though, that'll take in the bits that you don't know if there's any disease in there?
Yes, so that will treat all the pelvic lymph glands.
That sounds good, but you don't get to pick it, so that's okay.
Yes. So that's where, we don't know as doctors which is the best option.
Yeah, I understand that.
And we want to do the study, and we'll get more information and knowledge, and then we can feed that back into future patients so that men in the future who are having treatment for recurrent prostate cancer, like yours can have more knowledge about which is the best option for them.
Do they both take the same length of time? Because I was on treatment last time for quite a few weeks.
Yes.
So how long would I be on either or any of these?
Yeah.
How long would that be?
For the stereotactic treatment, it's 5 treatments, alternate days over 2 weeks. So it's quite a short course of treatment.
Yeah, it's short.
Yeah.
Yeah.
For the more extensive pelvic nodal radiation, we're looking at 2 different options for that. One is having radiotherapy over 20 days, probably very similar to what you had before.
Yeah.
Coming each day, Monday to Friday, for 4 weeks of treatment.
That's very much like what I had before. It was
Yes.
like that, yeah.
So that's the usual way we give radiotherapy, but we're also looking at a second option, having that more extensive treatment over 5 visits. So treatment alternate days over 2 weeks. So we give more radiation at each of the 5 treatment visits, but these days we're much better at shaping the radiation dose and minimizing the radiation that goes on to the bowels or onto your other organs. So we hope that giving the treatment in 5 sessions instead of 20 doesn't cause any more side effects, and that's a second question that we're asking in the study. Can we safely give the pelvic radiotherapy in 5 instead of 20
Yeah,
treatments?
because you wouldn't want more side effects, would you?
No.
No, definitely not.
No. Because we would hope that this treatment would cure your cancer.
I'm interested in being cured, so whatever you've got, that will do that. I'm all up for, But I didn't think I'd be getting a choice, if you see what I mean.
Yes, so if you go into the study, then you have to wait until you have the randomization to see, am I having the 5 treatments of SBRT, or am I having the 20 treatments of pelvic radiotherapy, or the 5 treatments of pelvic radiotherapy?
Okay. Once that's decided, will I know?
Yes. So our research staff will contact you, and then they will tell you which treatment that you've been allocated to. And then usually once we do that allocation, you would start treatment within the next month.
Well, I was going to ask that. How quickly would this take place?
So usually treatment would start approximately within a month's time.
Yeah, you did last time, yeah.
Yeah, so and the process would be very similar to what you had before.
And that will be here, this...
Yes, so it'll be in our hospital. We'll do a CT scan to plan the radiotherapy treatment. And then usually there's a 2 or 3 week gap, and then you'd start the treatment coming up as an outpatient for the daily treatment. So I've got some information here.
I was going to ask, do you have any... I don't
Yes.
really want to make a decision now. I need to think about it and talk to my wife and before I say yes. I mean, I want treatment, obviously,
Yes.
but I think I need to think about it because there's different treatments here. So
Yeah. So we've got a couple of things to give you. So this is our key facts sheet. So this summarises what happens on the study and what happens once your treatment finishes. Yeah. So part of being in a clinical study, a clinical trial, is that we'll follow you up regularly.
And I've been followed up by my GP.
Yes, we will follow you up with ourselves in the hospital. We can do that either in person or by telephone. But we'll also organise for you to fill in some patient-reported outform questionnaires.
Oh, right.
So these are questionnaires to see how you are in terms of problems with your bowels, problems with your waterworks, your general health. We'll get you to fill those in before you start treatment and at regular intervals after the treatment. And that allows us to see how your bowels, your waterworks, how you are in yourself, how that changes over time, and quantify the side effects that you're having from treatment.
Okay.
Yeah.
Do I post them back or do I bring those in?
So you can do them electronically. We can send you a link that you can then click on and do them electronically. If you have any difficulties with that, then we can send you paper forms.
I'm reasonable with computers.
So most people fill it in online because that's the most convenient.
Yeah. Okay.
So this just goes into a little bit more information about what the study is. So this is a large study that we're running throughout the United Kingdom, and we're planning to open up to 40 UK centres.
Tiger. Right. Why is it called Pointer? It says Pointer.
So yes, so it stands for Pelvis or Involved Node Treatment Eradicating Recurrence in Prostate Cancer.
I can see why you've got a short name for that now. But that's good. I like that name.
Yes, so men who go into the study will have had previous curative treatment for prostate cancer. In most men, that cancer never comes back, but in a small proportion, it can come back in the pelvic lymph glands.
Yeah.
And that disease is not very extensive, and what we want to do is, by using radiotherapy again, is to try and cure and get rid of the cancers.
So you want to knock it on the head as soon as you find it?
Yes.
So it doesn't start
Yes.
spreading everywhere. That's good.
And really, it's a second opportunity to cure prostate cancer.
Oh, yeah, please. Yeah, definitely.
So that's the aim of the study. It's funded by Yorkshire Cancer Research, and we're running it through the University of Leeds Clinical Trials Unit.
Okay, good. Will I be able to take this with me?
Yes, so that's for you to take. This is a more detailed information sheet that's got many more pages. Give it to your family and friends as well to have a little read of. But we would like you to know what's happening in the studies, so please do read through it.
Is there anybody I can ask questions?
Yes, so we have a research team, and their telephone number is in the back, and if you give them a ring, they can ring you back and answer any queries. Yeah. So what we'd like to do is give you this information and then contact you in the next week. If you're interested in going into the study, then we would get you to consent for the treatment, to sign up for the treatment.
Like I did before. I signed a consent thing.
Yes, we'd get you to consent for the treatment and for the study. The other thing that we're doing is we're trying to get new knowledge about the best way to treat prostate cancer, and we're doing some laboratory studies as well. So what we'd also like to do is to get your consent to take your biopsies that you had done before, to take those and look at them, and also to take some blood samples. This is extra research and this is optional, but we would take a blood sample before you start the treatment, at the end of the treatment, and 3 months after you finish the treatment. And we would look at those blood samples in the laboratory, and we're interested to see, are there new blood tests that we can run that can pick the cancer up earlier? Something that's called a liquid biopsy.
Okay. But you don't need to give another biopsy.
So we would just use your samples that you've had taken before and have a look at those. But we would need the 3 blood tests in addition.
Those are easy enough. I had bloods anyway at the doctor to get my PSA done.
Yes. Yes.
Just
the same as that, yeah.
Okay.
And I think that's just giving us the opportunity to do new laboratory research that, again, in the future could help men with prostate cancer. It's another way of perhaps picking the cancer up earlier.
Okay. Yeah, I don't have any questions now. I probably have about 100 soon.
So what I'd recommend now is having a read through the information.
Yeah.
We'll contact you in the next week, and then if you have any more queries, we can discuss those again. And then if you're happy to go ahead with the study, we would get you to consent for the treatment and randomise you into one of the 3 groups.
Okay. It sounds very interesting. Very interesting.
Thank you for your time.
Oh, thank you.
To find out more, visit ctru.leeds.ac.uk/pointer-PC.